Welcome to Geoff's Rant. The patient who presents with a class 3 malocclusion. The question is, are they a true class 3 or are they a pseudo class 3? So by pseudo class 3 we mean that when they go into centric relation we can get them edge to edge and then they slide forwards into maximum intercuspation, or what we call centric occlusion. But here's the catch. Just about every patient that sees an orthodontist who's a class 3 with a reverse overjet is considered a surgical patient. And why would that be? Because the patients have their lateral cephalometric radiograph taken once again in centric occlusion. So they may have slid forwards by 5 millimeters, and then all the cephalometric measurements show it's a class 3 skeletal, either a maxillary retrusion or a mandibular prognathism. However, if that ceph was taken in centric relation, those sagittal changes would be different. So in other words, to make the proper diagnosis, not only are your records, your photographs, etc., should be taken in centric relation at the initial contact position, but so too should the lateral cephalometric radiograph. So it's really important, if you're going to make the right diagnosis and then ultimately the right treatment approach for that patient, because if there is a CO-CR shift, there's a great possibility that this patient can be treated non-surgically rather than the traditional surgical approach that we see most of the time when a patient presents with a reverse overjet. So let's get the diagnosis right by the photographs, by the records, and also the lateral cephalometric radiograph taken in centric relation, and not the traditional approach of centric occlusion for those class 3 patients.